I'm going to try to keep my update brief and get to as many of your questions as possible today. First, our rates. Our weekly positivity rate is a little bit above 6% after nearly 6,000 tests. Since the start of the semester, we've tested just under 9,000 students and employees, and our total positivity rate since the beginning is 4.3%. I do want to make a distinction here that we calculate our positivity rate based on the number of people tested, which is different from the way that the state calculates its rate. There it is based on the total number of tests administered. So sometimes you'll see different numbers, but depending on whether you're talking about the number of tests administered or the number of people, that may account for the difference. If we use the same methodology, the state's current rate is 6.4%, and Wacomico County's rate is 9.9%, while SU's current rate is 6.2%. So while we're still under the state's rate, this is really a little bit higher than I want to be. I want to apologize for the delays that many students and employees experienced in getting their test results and getting cleared to return to campus. The University of Maryland Baltimore lab, which processes our test, changed the type of test that they use, and in order to be sure of the results during this change, they did extensive retesting of samples that were collected from our students and faculty and staff. While this new methodology improves the accuracy of the results, it also meant that they held on to tests to be run again, which caused some of the delays. Moving forward, our IT department is working on a process that will be integrated with campus health to clear all students and employees for return to campus at the end of their quarantine and isolation periods. Students and employees without a test should go online and schedule one immediately to regain their access to campus. Okay? Moving forward, we will test members of the campus community on a monthly basis. Essentially, you will need a negative test every 30 days or an exemption from campus health to maintain your access to campus. This time, we're going to do the tests on a rotating basis, so we'll have more days and more hours to add flexibility and to decrease the wait times at our testing center. I also want to implore our campus community to abide by the new City of Salisbury executive order regarding gatherings at private residence. There's no more than 15 people indoors and 50 outdoors. This order does not apply to businesses, churches, restaurants, offices, etc. I want to thank all of the faculty and staff for your incredibly hard work during this pandemic. This has been a very challenging time for higher education, but the team at SU has faced this pandemic head-on, and you continue to provide the education and services to our students that I know we are all very, very proud of. So thank you. We are open. We are a university that's open, and we intend to remain open, but we all have to work together, and that includes practicing good hygiene, social distancing, and most importantly, wearing masks. All of the things that we do around campus, all of the dollars that we spent, all of the signs, all of the changes in instructional modalities and activities are helping. But the single most important thing that you can do, that we can all do, is wear your mask. So please wear your mask all the time. Now I'll get to your questions. Eli, what's the first question we have?
Dr. Wight, students were promised in-person classes and certain modalities of instruction. What do you have to say to those students and parents as those are changing?
Right. So this past summer, we asked faculty which modalities they wanted to teach. During our so-called Level 2 operations, faculty had choices of teaching fully face-to-face or hybrid, which is a combination of face-to-face and online, or remote, which is a synchronous class like Zoom, where everybody is in different places but interacting, or what we call online, which is asynchronous work, mostly independent and small group study. So the hope was that we would be able to give faculty their choice of teaching modality and students their choice of what kinds of courses they wanted to take. And mostly we met in the middle. But as the positivity rate for COVID has increased on our campus, many faculty have, at our encouragement, moved their face-to-face and hybrid classes more toward remote and online. And this gives us some challenges with students who have less flexibility about their mode of instruction. There are also the reverse cases where faculty have remained teaching in a hybrid or face-to-face modality, and students have requested to take courses online. So this changes, and unfortunately we're not able to keep everybody happy, but we're doing the very best that we can.
Dr. Wight, there's a question here about attention to long-term effects of the coronavirus, particularly for athletes.
Yes. I think you've seen in the press that there is some concern now about the long-term health effects of COVID-19, especially with things like heart problems and especially with athletes. And I think this is a good reminder that even if most young people have mild symptoms or in some cases no symptoms at all, there is still a danger to this disease, and it behooves all of us to be very careful to avoid it if we possibly can, and it reinforces the need to wear our masks, everyone.
Do you see evidence of spread on campus or in the classroom?
Wow, that's a good question. The thing about a disease is that it's not possible to say definitively exactly where the transmission occurred. But we can look at various metrics to infer the relative rates of spread on or off campus. What I would say is that the preliminary data that I have suggests that our faculty rate of infection is significantly lower than our student rate, and the rate of infection among our resident students is significantly lower than the rate of infection of our students who commute to campus every day. And so, given that totality of indirect evidence, it suggests that most of the spread of the virus among our campus community is actually not happening in classrooms and probably not happening that much on campus. And that's simply because we are paying much more attention to behavior on campus, mask wearing, hand hygiene, and social distancing. And so it's likely that the spread is occurring mostly off campus than on campus.
We're getting some questions about the testing. Are students that are all virtual or online required to get a test?
Anybody who has a reason to come to campus at all must have a test. And that's most students. So for example, in my class, I have many students who, my class is a hybrid class, and I have many students who prefer to Zoom into my class sessions at least one day a week, and a couple of students 2 days a week. But we still have exams, and so my students are going to have to come to campus for exams, and to do that, they are going to have a negative test. They'll have to be cleared to come to campus. So if you have a need to come to campus at all, even once, then you must have a negative test and be cleared to come to campus. If you're absolutely sure that you never are going to come to campus, then you don't need to have a test. But that's rare.
Dr. Wight, where are SU's numbers being counted other than our own dashboard?
So we count on our dashboard all of the tests that we administer. So when we take samples and we send them to the lab at UMB and get the results back, all of those results are posted on our COVID dashboard. Now, the state counts the number of positive cases by county, and those results are reported to the county of the student's home residence. So, for example, if the permanent residence of a student is in Montgomery County or Prince George's County or somewhere else, or perhaps even out of state in Delaware or New Jersey or another state, then those results are reported to those other counties and those other locations. So only students who have their permanent residence in Wicomico County would contribute to Wicomico County's overall positivity rates.
This is a technical question, but is the quarantine or isolation period the same for someone that is asymptomatic as it would be for someone that had a positive test and felt symptoms?
The rules on this are somewhat confusing, but let me consult my notes here and I will try to get this right. If you have a positive COVID test, then what you are asked to do is to isolate yourself. And so that period of isolation is at least 10 days. If you are identified through the contact tracing process as having a close contact with somebody who had COVID, tested positive, then what you're asked to do is to quarantine. And that quarantine period is 14 days past the last day of your close contact with somebody who was positive for the disease. I know that's complicated, and the periods of quarantine and isolation are different, but it's roughly 2 weeks.
And the last question that we have, Dr. Wight, is related to the factors and indicators that would lead to a change in operational levels. What are the things that you're looking at that would lead you to make a decision to move more things online or to bring more activities online?
Well, when we consider making decisions about changes in levels of operation, and these days it's just about every day, we take many things into consideration. Of course, our overall level of positivity is important, and something called the case rate is also important. That's the number of people who are testing positive compared to the population of our area. We have to compare those things to the rates in our county, Wicomico County, where Salisbury University is, but also the surrounding counties and the state rates of positivity. And so far, we've been at least a little bit below those county and state rates. We also have to take into consideration capacities. Capacity to isolate students who need to be isolated after testing positive for COVID, capacity to quarantine students who have come into close contact with people who have COVID. We have to consider the capacity of the local hospital to hospitalize people. There are many, many factors that we have to take into consideration in making a decision like that. But for now, we've made the decision to remain open.
Thanks, Dr. Wight. Those are all the questions that have come in today.
All right. Well, thank you for joining me. As always, practice good health, good hygiene, especially hand hygiene. Practice your social distancing. It's really important. But remember, the single most important thing you do is to wear your mask. Thanks, everybody. We'll see you next week.